Diabetes, and more specifically type 2 diabetes, is a chronic condition that affects millions of Americans. Dr. Roy, Chief Medical Officer at UnitedHealthcare of the Mid-Atlantic, joins us now to talk about diabetes risk factors and treatment options. So great to see you. So let's dive right in. Talk to us about diabetes and your role with this.
Sure. Diabetes, first of all, is a chronic medical condition, right? And it's essentially where either the body doesn't secrete enough hormone called insulin, or it cannot utilize it appropriately. And over time, what it results in is elevated blood sugar levels in the body, which damages a variety of organs in time. About 40 million people in the United States live with diabetes. What's more astounding is about a fifth of those people are just simply unaware they have this condition. Mm-hmm. There are two major types of diabetes. There's type 1 diabetics who are really just can't produce that insulin in the body, and type 2 diabetics which can't utilize that insulin typically well. About 90 to 95% of people have type 2 diabetes, so that's the overwhelming number. In West Virginia, nearly about 250,000 adults have diabetes, and that's about a fifth of the state's adult population.
How much does lifestyle, these factors, play a role in developing diabetes?
Yeah, lifestyle contributes a very large degree in many health conditions, especially diabetes. And when we talk about lifestyle, there's two major things: our level of activity or inactivity level, and what we eat. So our dietary habits really play an important role in our diabetes management and to prevent diabetes. When we think about being overweight or obese, obesity is linked to about half of the new cases of type 2 diabetes each year. And that's very important to understand because about 600,000 adults, or 4 in 10 adults in West Virginia, are classified as obese. Right? And 3 in 10 adults just don't get enough physical activity, so they're inactive according to the American Health Ranking.
You're talking about getting our weight under control. What are some other things that we could all be doing to improve our habits and reduce the risk of diabetes?
So again, diet and our activity level are the two big things. So our diet is very important. So generally higher fiber foods, limited processed foods, vegetables and fruits in combination with lean proteins should be a part of the diet. There's great information available on the American Diabetes Organization website, the ADA, or diabetes.org website, and also on the CDC.gov website, the Centers of Disease Control and Prevention. Mm-hmm. So they have great information on diabetes. From a physical activity level, there's a real recommendation about getting moderate intensity activity about 2.5 hours a week. And at least 2 days a week of muscle strengthening activities. And that moderate intensity activity is really a brisk walk where you can still speak, but have get a little shorter breath when you kind of speak and talk at the same time.
I like that.
And finally, go ahead.
I was going to say, I like that you mentioned walking, because that's something simple that really most of us can do and add a little more of it to our day.
Absolutely. I mean, an even simple walk after each meal can help a long way in managing our blood sugar levels. Mm-hmm.
If we want to learn more information, where's a good place to start? You added a couple of resources there. Where should we go if we want to learn more?
So one of the great resources is definitely talk to your employer group about what kind of programs are available or your insurer. At UnitedHealthcare, we offer something called Level 2 for eligible employees with diabetes. This allows for access for a continuous glucose monitor, a team of doctors, nurses, coaches, and dietitians to really work with people about controlling their blood sugar levels, not just about their weight, but their physical activity levels, what they're eating, making sure it's healthy, and trying to work towards remission where it's possible, where we can reverse diabetes in a way if it's possible. And there's a lot of other apps and web-based programs out there, so really connecting with your employer group and Health Assure becomes important.
Well, Dr. Roy, you've given us a lot of great information today. Thanks so much for sharing it.
Well, thank you for having me.